Welcome back to Studio 701. You know, Michael, you have a beautiful smile.
Ah, well, thank you.
Did you have braces?
You know, I didn't have braces, but I spent a lot of time in the orthodontics chair. Yeah.
Me as well. I had to go through the braces phase.
Oh, yeah.
Which, you know, I think I had them on for a year. The rubber bands, the whole deal, the tightening. I can still feel that, like, phantom pain.
It's a rite of passage.
It is. It really is. But you know what's kind of interesting? How much things have changed and updated. So Dr. Sid Schmidt from Prairie Rose Family Dentist talks with us about all of the options for straightening your teeth. Dr. Sid Schmidt, thank you so much for being here today.
Thanks for having me.
Well, if you think your teeth aren't quite as straight as you'd like, you might think, I need braces, or do I need Invisalign? So that's a big question we have, is kind of what is the difference between the two?
Yeah, well, actually, Invisalign is a clear aligner system, very similar to a retainer that, you know, most people are familiar with. And the advantages of Invisalign is it's very difficult to tell that you even have braces or your teeth are being moved by other people. So the cosmetic advantage of it is great. Most of my adult patients don't like to have the traditional hardware and the wires and brackets sticking out, and this is a great way to mask that and to not, you know, have other people know that you're actually getting your teeth straightened. Some other big advantages to it is they're much easier to clean than traditional braces. There's a lot shorter visits, so you don't have to go in as often as you do with traditional braces. And then the other issue with traditional braces is they can be painful. They can hurt. You're moving teeth with brackets and wires, and this is a great option for people that you're able to take them out. You can eat the foods that you like to eat. You're able to clean your teeth a lot more, a lot easier than had you going through with traditional braces.
I have another question with that. How long can it take for you to really see a difference from wearing Invisalign?
It's amazing. It really, I mean, I have patients that, you know, they wear them for a month or two and we can really see a lot of tooth movements. The average tooth movement usually takes, you wear your trays anywhere from 7 to 10 days is typically how long you'll wear the trays. And then you'll switch to a next set of trays which move your teeth further. But, you know, some cases can be anywhere from, you know, a month or two to all the way up to, you know, a year or two. You know, depends on the severity of the case.
So who is eligible for Invisalign?
Pretty much anybody. I shouldn't say anybody, but most adults for sure. I would say anybody over the age of 14, because typically in order for Invisalign to work, you have to wear the aligners or the trays. And unfortunately, younger kids aren't as responsible. You know, they may lose their trays. So typically we'll say 14 years or older is a good guideline, as long as that 14, 15, 16-year-old is responsible and will wear them and take care of them. So.
And so, Dr. Sid Schmidt, we're talking about, you know, trays, and Invisalign involves, you know, putting a tray on. Makes me think of a night guard, which is something used as a preventative measure for overbites and maybe grinding your teeth. Do I have that right?
It is very similar. It is a clear aligner or like a resin, very similar to a night guard that you would wear at night, or it's much thinner. You know, the technology is able to move your teeth into different positions over a period of time, but the concept is very, very similar. Yes.
How can wearing something like that improve some of the ailments you might have?
Well, what's amazing is there's a lot of problems with malformed teeth. People can run into periodontal issues because of pocketing that'll arise from teeth that are not positioned correctly. We'll run into people that have issues with recession with their teeth due to the forces that they're chewing, the way they're chewing on their teeth. You'll run into cracking, you know, restorations breaking, teeth breaking, all due to occlusion. So it's not just a cosmetic issue, but it's something that you want to visit with your dentist about. You know, some options, and really to take a real hard look at, you know, your bite and some of the problems that can be attributed to that.
All right. Well, thank you so much for all the information today.
You're welcome. Thanks for having me on.
All right, and make sure you visit one of the 3 Prairie Rose Family Dentist locations. Their numbers and addresses are listed on your screen. But keep it here, because still to come on Studio 701, our parent panel is back, and we're sitting together to discuss an important topic for April.
That's right, but first, everyone get up out